Doctor, I want to ask you a few questions about the subject that you took up on direct examination. All right. That is the epidural and combined spinal and epidural anesthesia. Very well. An intravenous drip is set up, is it not? Yes, and your pulse and blood pressure are monitored. You will be asked, doctor, to curve around your bump if lying on your side, or to curl forward over your bump if sitting up. Well, I have to say that the skin over your lower back is cleaned with antiseptic, then injected with a local anesthetic. Doctor, an epidural needle is gently inserted, is it? Yes, it is. Where? Between two of your lower back bones. And they are what? They are the lumbar vertebrae until the anesthesiologist feels the loss of resistance as the needle enters the epidural space surrounding your spinal cord. Doctor, if you are having a combined spinal and epidural, another needle is inserted, is it not? Yes. Through what? Through the first needle to puncture the underlying membranes, the dura mater, and inject local anesthetic into the cerebrospinal fluid, which is the second needle. Doctor, a small flexible plastic needle is used, is it not? Yes. The epidural needle goes into your epidural space. And doctor, that is the epidural needle is then reinserted, is it? Yes, and the catheter is taped to your back. Doctor, the local anesthesia can now be injected, can it not? Well, through the catheter into your epidural space for continuous or top-up pain relief. Doctor, the spinal injection works almost instantly to remove all sensation and ability to move from the level of your nipples downward. Its effects wear off within 60 to 90 minutes, however. An epidural provides similar loss of sensation and pain, but works more slowly. 10 to 15 minutes to take effect. Is that not correct? Well, it can be topped up. What do you mean by topped up? Provided pain relief for as long as necessary, however, and for post-op pain relief. Doctor, combining the techniques provides the benefits of both, does it not? Well, making it a popular opinion or option for cesarean section, yes, I would say so. There is some pulling and tugging, however, those types of movements. And doctor, an emergency cesarean can be life-saving for both mother and child, can it not? Well, women also have had a cesarean, which is slightly less likely to develop future urinary stress incontinence than women who have delivered normally. But these findings should not be used to justify having an elective cesarean section. Doctor, in younger women, hysterectomy without oophorectomy, that is, removal of the ovaries, is carried out where possible? Yes, it is. In older women? Yes. Those who are approaching the menopause, hysterectomy plus oophorectomy may be advised. Doctor, is it advantageous? Well, I would say it is the menopause which is approaching, and that is what is developing the ovarian cancer. It is estimated that 1 in 500 women whose ovaries are conserved will develop an ovarian malignancy. Doctor, what is hysterectomy? It is carrying out as a vaginal or abdominal operation. Where possible, the vaginal route is used to avoid an abdominal scar, but around 2/3 of the operations there are still performed abdominal incisions. Doctor, if you are having a total abdominal hysterectomy, the surgeon will try to use a bikini line incision. Is that not correct? Well, occasionally a vertical scar is necessary if the uterus is exceptionally bulky with large fibroids. A short form for bikini. Expect to get that in a medical.